Dr. Uday Goutam, sir. See, brain and spine conditions have been challenging not only for patients but their families also. So, how recent advancement in neurosurgery has helped improve treatment outcomes and how it has been able to, you have been able to win patient confidence, sir?
Actually, I'm Dr. Uday Goutam, Neurosurgeon from Goutam Nookathota Hospitals, Hyderabad. Regarding to the brain or spine, whatever, the surgeries are very complex. So patient expect outcome. So that depends on the individual disease itself. For example, if you take the brain, they come with brain tumors or, for example, CP angle tumors. Before preoperatively, they will have only the pain or numbness or twitchings or other any shooting pain over the cheek or teeth. So when we examine, when we do the CT scan and MRIs, there might be a huge tumors and with a lot of brainstem compression and nerve involvement. In that case, if we operate, so post-operatively they may encounter with some neurological deficits, probably facial nerve injury, or in case if any tumor in the eloquent areas, brain, where the speech center or hand movements or leg movements involvement in area, any motor and sensory areas, if you operate, so immediate post-operatively, if there is any deficit, it is very difficult to accept from the patient side. So in that case, how to achieve the complete excision of the tumor, and in addition to that, preservation of the neurological function is very much important, and that with the acceptance of the patient and patient relatives. So we need to explain everything to the patients. So you are having the symptom, brain tumor, and any involvement of the eloquent areas. In that case, we need to explain. So this is a win-win situation. So complete excision versus preservation of the partial excision with the preservation of the neurological function is very much important in this case. So in that case, if you explain everything beforehand, so acceptance from the patient side is very good. So if you take the spine issues, so nowadays many recent advances has come. So earlier we have only open surgeries, laminectomy, discectomy. When the expertise is increasing with innovation of the new technology, microscopy has come. So we do microscopic discectomies with interlaminar approach to preservation of the bone structures. We don't remove lamina. So we dissect only muscles and remove the disc. In that case, post-operative immediate recovery is expected with very little post-operative pain and early ambulation. So even nowadays, even the good advancement, endoscopy has come. So in that case, while doing the endoscopy, we have to explain the patient. There might be some patient selection is very much important. If it is acute disc with a single disc, doing the endoscopic discectomy is very good. We can achieve good recovery and good decompression without any nerve injuries.
Thank you very much, sir.
In that
for this
way,
wonderful
we get the patient acceptance.
Yes.
India's most trusted Neurosurgeon 2026 award goes to Dr. Uday Goutam Nookathota, Neurosurgeon and MD Goutam Neurocare. May I kindly request Dr. Uday Goutam Nookathota to please come forward and receive this prestigious recognition.
Hello sir, very good morning sir. Welcome to the Inside Excellence Award. Sir, I want to know who is the biggest support and the inspiring along the way.
Actually, my biggest support is my mother, but she is no more. But her blessings are on me. When I was in childhood, she wanted me to become a good doctor, and especially a neurosurgeon. Now in that way, I'm doing the better services to the patients as well as to the public also by doing free medical camps and giving good success to the our patients also.
Sir, what is the key factor your success?
Key factor is for every neurosurgeon, the precise identification of the lesions, precise identification of the diseases, and for the execution of the treatment. Especially if in case neurosurgery, the performing surgeries and complete excision of the tumor or any lesion, or in case of the disc prolapses, doing surgeries in a minimal invasive way and giving complete care, complete relief to the patients, and without giving any neurological deficits. When the patient walk into the hospital, as he comes into the hospital with some of the headaches or giddiness or any memory disturbances, he has to go out with a complete recovery. That is the main my key success.
It was nice for speaking with you, sir. Thank you so much. Please proceed.